Bismillahirrahmanirrahim. This session we are going to explain the heart. As you know, if you imagine that my hand is the diaphragm, the heart is going to lie in one of the surface that we call the inferior surface on the diaphragm. So here you can find the anterior surface, inferior surface or diaphragmatic surface, right surface, left surface, base will be here in the right side backward, and apex is here forward, downward in the left side. As you know, the 2/3 of the heart is visible in the left side of the thorax cavity. The heart consists of 4 chambers: right atrium, right ventricle, left atrium, and left ventricle. The sulcus coronary is visible here. Sulcus coronary is a sulcus that is going around the heart and divide both atrium to both ventricle in anteriorly and posteriorly. The sulcus coronary is visible here. Also, from the external view, here I am able to show you the anterior interventricular sulcus, and here I am able to show you the posterior interventricular sulcus too. Now we are going to open the right atrium to be able to explain the right atrium. This muscular pouch we call the right auricle. Right auricle is going to connect inside of the lumen of the right atrium. Anterior wall of the right atrium, the origin comes from the proper atrium during the embryonic period. So when we cut and we open, we can find the pectinate muscle. But the posterior surface of the right atrium is smooth because this part origin from the sinus venosa. From the external view, if you look at vena cava superior, and here you are able to look at vena cava inferior orifice and vena cava superior orifice. From the external view, here I am able to show you the sulcus terminalis. If I go inside of the right atrium, this part I am able to show you the crista terminalis. So crista terminalis from the internal view and sulcus terminalis from the external view. Now look at to the superior vena cava without wall, inferior vena cava with a rudimentary valve that we call the valve of the vena cava inferior, and the right atrium is going to connect to the right ventricle through the right atrioventricular orifice. This right atrioventricular orifice is going to be guarded here by a valve that consists of 3 cusps. We call the tricuspid valve. Inside of the right ventricle, I am able to show you the inflow and outflow. Outflow of the right ventricle, here we call the infundibulum or conus arteriosum. Arteriosus superior to infundibulum, you can look at to the orifice of the pulmonary artery, and this part is going to guarded by a valve with 3 seminolar cusps. If you look at to the cusp of the pulmonary valve, the central, the middle, this part called the nodule, and lateral part, this part we call the lonule. So nodule is in the central part, in the middle part, and in the lateral part, this part we call the lonule. And this space behind each cusp called the sinus of the pulmonary artery. Inside of the inflow, we are able to show you 3 kinds of the muscle, 3 kinds of the trabeculae. Some of them are called ridge, some of them we call bridge form, and some of them we call the papillary muscle. If I look at to the right ventricle in this heart, I am able to show you the papillary muscle. From the apex of the papillary muscle, the chorda tendino are visible here. Chorda tendino are going to attach to the cusp of the tricuspid valve. And another form we call the ridge form. About the ridge form, you can pass, for example, your needle from the middle part of this muscle. One of them is here, that we call the moderator bone. Moderator bone is one of the ridge form of the muscle. You can pass your pancet for forceps inferiorly, because both ends attached to the wall of the right ventricle, and the middle it is free. This form of the bridge form we call the moderator one. It is special because inside of this bridge form of the muscle, some of the bundle that depends to the conductive system are passing through this moderator bone, through this bridge form of the muscle. From the apex of the papillary muscle, chordal tendon are visible here because the tricuspid consists of three cusps. So we have three group of the papillary muscle. One of them is visible here. Now we come back to the left atrium. Left atrium is going to form most part of the base of the heart, and if we open the left atrium, we are able to find in each side the opening of the pulmonary vein, in each side two pulmonary veins without any valve. They are going to open inside of the left atrium. Left atrium is going to connect to the left ventricle through the left atrioventricular orifice, and this orifice is going to be guarded by a cusp, by a valve that consists of two cusps. So we call the mitral or bicuspid. Again, inside of the left ventricle, we are able to show you two groups of the papillary muscle. Some of the muscle we call the ridge, and some of them we call the bridge. About the bridge, again, you can pass your, look at here, the forceps in the middle, and both ends attached to the wall of the left ventricle. Please compare the thickness of the wall of the left ventricle and the thickness of the wall of the muscle in the right ventricle. As you find, in the left ventricle it is 3 times thicker because the blood pressure in the left ventricle is more than the right ventricle. The outflow of the left ventricle called the vestibular of the aorta, and here we are going to look at the ascending aorta. At the beginning of the ascending aorta, again you can find a valve with 3 semilunar cusps. Please compare this semilunar cusp with the cusp of the pulmonary artery. The cusps here are larger and denser than the pulmonary cusp. And posterior to each cusp, again, we can find the sinus. 2 of the sinus, look at here, one of the sinus are visible here. Inside of the aortic sinus, you can find orifice. This orifice belongs to the coronary artery. So we have 3 sinus of the aortic, and 2 of them you are going to find 1 orifice, and each of them belong to the 1 coronary. Now look at to the artery. From the ascending aorta, you can look at to the right coronary artery. Right coronary artery have some branch for the right atrium, for the right ventricle, and also have a branch that it is coming to connect to the we call the right canal. It is coming anterior to the infundibulum. From the right coronary, it is going to be found inside of the sulcus coronary in the right side. Have a large branch that called the right marginal branch, and it is going in most of the heart continue and go inside of the posterior interventricular sulcus, and this part the name changed to posterior interventricular artery. Now all of the right atrium and most of the right ventricle are going to supply by the right coronary artery. About the left coronary artery. Left coronary artery, at the first, it is passing posterior to pulmonary artery. Very soon, divide to 2 branches. One of them we call the anterior interventricular artery. This anterior interventricular artery is going to enter to the anterior interventricular sulcus. This branch arises from the left side. We call the diagonal branch. Have so many branches, such as this, that called the septal branch. This septal branch, when I show you from this side. You are going to look at the septal branch, and also have a branch that called the left conal branch. This left conal branch is going to anastomose with the right conal branch, and another branch that arises from the left coronary called the circumflex. Circumflex is going and enter to the sulcus coronary. From the circumflex, you can find the left marginal branch, and the circumflex also is responsible to supply the left atrium, left ventricle. Between the left atrium, left ventricle, inside of the sulcus coronary, in the posterior view, you can find the sinus coronary. Sinus coronary is visible inside of the sulcus coronary, and all of the veins are going to drain to the sinus coronary. As you know, here you are going to find the greater cardiac vein in the anterior interventricular sulcus. In the posterior interventricular sulcus, you can find middle cardiac vein. Posterior to the left ventricle, you can find the posterior ventricular sulcus vein, and here also you are going to look at to the left marginal vein. All of them are going to drain to the sinus coronary. Between the right atrium and right ventricle, you can look at to the lesser or small cardiac vein.